Hello, I'm Dr. William Dooley. I'm a surgical oncologist. I practiced at Johns Hopkins and more recently the University of Oklahoma, and became interested during my career in microendoscopy. I had a clinical problem in the late 1990s being able to identify women who had abnormal cells and molecular biologic characteristics suggestive of a cancer coming from a single duct in the breast. But we could not identify the cancers using any normal mammographic, MRI, ultrasound, or nuclear medicine technologies. I knew from experience from Osaka in Japan that microendoscopy was possible to use in the breast to identify abnormal lesions, but there had been some difficulties in being able to visualize the ductal system completely. I used a small microendoscope and was able to, in 6 patients in 2000, identify small sub-centimeter cancers not visible any other way by direct endoscopy of the ductal system. Over the subsequent years, I have worked with an engineer and developed a new microendoscope system which will allow visualization of ductal structures or small spaces anywhere in the body that are accessible by a 22 gauge angiocath or sheath. This scope I want to introduce to you now. It's a perfect way to work up abnormal nipple discharge, but can help you identify multifocal disease and breast cancer. Could be used in a number of different places around the body and can be made to varying lengths and sizes for use. This is the scope, and the scope we're currently showing, the first version from Shagamed, is a 0.6 millimeter fiber. It's a very, very small fiber, and for purposes of the breast, we would place this sheath within a thin metal tube, 0.9 millimeters in size, and inject saline or local anesthesia to distend the ductal system. The scope extends just 2 or 3 millimeters beyond the tip and can be used to access any fluid producing duct in the breast. It has a standard light port. This is a LED light source which would allow you then to see in the duct. In the breast, it's very easy once you find a lesion to identify it and remove it, because all you have to do is turn the lights off in the room and look at where the light transilluminates the skin. And then you can biopsy it either under direct vision or with a minimal access technique, such as coring biopsies. The scope can be made to any length and is small enough that it can go down the working channel of most modern larger scopes such as gastroscopes or colonoscopes. So you can imagine what microendoscopy might be able to do. The images we receive from the scope are a whole high-definition TV screen full. It really is almost 60x magnification. And with that 60x magnification, you're able to make great detail, see lesions down to fractions of a millimeter in size, and be able to do chunky cytology biopsies. Now with new techniques of molecular pathology, we're able to do more and more with these chunky cytology biopsies and be more accurate. Single cell techniques that are being used for liquid biopsy allow the potential of this to molecularly map up and down ductal systems to check and find things as they're developing into cancer, monitor chemoprevention, and turn breast cancer and many other cancers arising in small ductal structures into a situation similar to colonoscopy. So, join us, experiment with this, use this for pathologic nipple discharge, but also imagine how microendoscopy might change your entire approach to many areas of the body. Because if you can access it with a 22 gauge sheath, you can see inside it. Thank you very much.